As January came to a close, TrueLove journalist published on News24 Ntombi Khulu explores tips on how we maintain sober habits in the new year, as more and more people are seemingly returning to their default settings. Khulu speaks to social worker Mandy Stokes about how people can tackle addiction and pick up healthy habits. A study by the Economics of Excisable Products of the University of Cape Town found that household expenditure on tobacco and alcohol products directly and negatively impacted on children's welfare and development. Let's discuss this now. We're joined by social worker Mandy Stokes and research officer Dr Zunda Chisha. Good morning to the both of you, and thank you so much for joining me this morning.
Morning.
Thank you very much. Good to be here.
Thanks. Firstly, Mandy, from a clinical psychology perspective, what distinguishes short-term abstinence, like dry January, from sustained sobriety?
I think, when people engage, and I think it's a good place to start with dry January, to kind of reflect on, and that's really what the article is about. Like, you need to reflect on like what function did alcohol and other addictions play in your life, as opposed to it just being oh, let's grit through it, okay? In order to kind of sustain the change, it's really about creating a life that doesn't allow for that much space for the addiction to develop.
Now, Doctor, let me come to you. What motivated this research into tobacco and alcohol consumption and, of course, household spending in South Africa?
Yeah, fantastic question. So it was really a number of things. When we look at just the economic cost of, let's just focus on alcohol specifically, studies have shown that this cost can amount to anything between 10 and 12% of GDP lost due to alcohol harm. That's a lot of harm from one particular product, the consumption of one particular product. We also know that alcohol consumption is basically linked to a number of different social ills, right? It's linked to crime and violence. It's linked to hospital burden in terms of just the amount of injuries and various other effects on the healthcare system. It's linked to road safety. It's linked to poverty and at the household level, which is some of what I was trying to look at in my study. And it also leads to unsafer communities. So we know that there is a high correlation between higher alcohol outlet density and high crime rate and violence in communities. So it's a whole range of issues that are linked to the consumption of alcohol. Now, we know that South Africa only consumes roughly, I think about a third of South Africans consume alcohol, right? So those that say that from surveys that they actually consume alcohol is only about a third. But it's really the patterns of consumption that are worrying and that really are linked to a number of these issues that I've highlighted. So that was really the motivation behind the study, to really look at what more evidence can we bring to the table to try and convince policymakers to address the issue. And for communities and the population to really think about what it is they're doing in terms of alcohol consumption.
Sure. Now, speaking of evidence, Mandy, what evidence-based behavioral strategies are most effective in maintaining sobriety beyond a fixed period?
So first of all, it's about, becoming aware of what needs you have, okay? What function has alcohol played? And then to reach out to either, there are free support groups, 12-step based, SADC runs free support groups. You can reach out to a social worker, clinical psychologist, in order to kind of start working on a therapeutic process to be able to do that. If you're at that space that you actually need to go into treatment, then you start making arrangements to do that. And not what we normally work with, okay, quite often a lot of our treatment centers have got a 12-step facilitation modality. CBT works really well. DBT works really well in terms of helping you with regulating your emotions, if that's the reason why the function that alcohol has actually been, playing in your life.
All right. And Doctor, in simple terms, what does your research reveal about how tobacco and alcohol spending reshapes household priorities And what does the data reveal about long-term consequences for children in affected households?
So basically, the data shows that consumption of alcohol and tobacco within a household does affect negatively child health outcomes. So specifically, I was looking at what's called height for age, and which is sort of slightly longer term method of just estimating the sort of well-being of children under the age of 5. And basically, we found that compared to households that did not consume tobacco or alcohol, those that did had negative height for age estimates and outcomes from consumption of these products. So there is an impact that we're seeing in children within households that have these types of consumptions taking place. And obviously that has longer term impacts, right? If we think about how this would affect the mental health of the children, first of all, going forward, we think about the employability in future generations, right? We think about all of these different aspects in terms of economic productivity, labor productivity. All of these aspects down the line will ultimately be affected as a result of this type of negative consumption.
Now, Mandy, people who stop drinking alcohol or detox often say that they find that they realize that they no longer have anything in common with the, with the people in their social circle. So how does one redefine their social identity when alcohol has long been a central part of their lifestyle?
I mean, that's really the process of, that is the process of recovery, okay? So it's, when you hopefully dry Januaries for a lot of people have actually created the space for them to think about, you know, like, who am I? Why am I drinking? You know, like, what am I missing about the people that I was initially hanging out with? Okay. Mm-hmm. And then to get to a place of you know, reprioritizing. And I really like, I mean, that research is really good in terms of motivating people to see, you know what, my behavior right now is affecting my children. And even if there's no children, like being able to look at, you know, like, what is it that I want? So you kind of need to reassess. Alcohol does, like, we don't have to fit in with what everyone else is doing around us. And that 30%, I can remember, I mean, I'm a recovering person myself, and I was also surprised. Only 30% of people drink, okay? You know, and yeah, I thought everyone does.
I'm
you know?
surprised. And often when you're the one that doesn't drink, the first question would be, why?
Yes, exactly.
Yeah. So now, Doctor, why are lower income households disproportionately affected by these spending patterns?
So there are a couple of reasons. So first of all, if you think about the household budget, right? The household budget for a low-income household or a low-income household is much smaller, both in real terms and in terms of absolute terms, than say, middle-income household or a high-income household. And so when that small proportion of income that you have is made even smaller by your spending on other products, other services, and other things, because you're spending on alcohol, it means you're not able to spend on these other things that could potentially be beneficial to your household. Right? As a result of that, the impact that it's having in your household is much greater than it would have in a household which has a higher income, level, and so on. So you have a situation where, because you are shrinking the amount of money that you could potentially spend on, you know, food, on education, on transport, you are then affecting a bigger part of your household than if you had a higher income to be able to spend on these other things. So it's basically shrinking your ability to spend on the good things in your home.
So how much worse is it for those who rely on grants? Let's say they get that 300 and something rands and they prioritize it on alcohol as opposed to the necessities for the household.
Yeah.
So in my study, I didn't specifically look at that, but I would imagine if they're not spending it on what the grant is meant to be spent on, then obviously it has the same sort of, you know, negative effect, right? The grant is not having the impact it should have. What I do know is that some studies that have looked into this issue have found that there is quite a gendered pattern. So it largely depends on who is the head of the household, whether it's male or female and so on. And there's quite a distinction between that. And you can quite easily understand that from the context of the patterns of consumption that are prevalent. We see that a lot of this alcohol consumption is much more amongst men than women, and even the type of consumption is much more dangerous amongst men than women. So we think of heavy episodic drinking or binge drinking is much more prevalent amongst men than women. So you can actually make that link through these types of pattern recognitions and so on.
Now, Mandy, at what point does casual or social drinking become a psychological risk rather than a lifestyle choice?
So, I mean, it's a process of, like an addiction to any subject, substance or behavior develops over time, but because it's based on your rewards, your brain's reward system. So if if you're not paying attention to what's going on, it slowly kind of creeps up. So someone who only binges on Friday, then binges on Friday and Saturday, then it's Friday, Saturday, Sunday, then they start missing work, okay, because they still have a hangover on Monday, and there's a creep that happens, especially with alcohol. You know, when we're talking about sort of the street drugs, okay, heroin, crystal meth, all of those things, the road to addiction is much quicker. But alcohol is quite insidious in how it shows up, because everyone is actually drinking, if you stay within that circle.
Sure. So at what point should someone consider professional help? I mean, or psychological support to maintain sobriety? Mandy? So
if you try and stop and you can't, okay, so hopefully you already have that awareness, ask for help, because it is a difficult thing to get out of yourself, okay? When people are saying to you, you need to stop, and you think that, and I mean, quite often I get contacted by families, not by the person that actually needs help. So they need help in order to do the intervention for people to get the help, because when you in the cycle of addiction,
you're in denial.
You can't necessarily make good decisions. I kind of want to link it to what Doctor was saying, because he mentioned, like, sort of where does the money go? It's not just on the alcohol. Really bad decisions get made because you're not making the decision, the alcohol is making the decision. Because with that comes gambling, with that comes impulsive spending, all of that stuff.
Sure. Before we wrap, Doctor, if there's one key message policymakers and the public should take from your research, what is it?
I think the key message is that we can do more to regulate alcohol consumption in the country, and we should be doing that.
Oh, short and sweet. Thank you. Thank you both for your time.
It's a pleasure.
All right. That was social worker and addiction counselor at the South African College of Psychology, Mandy Stokes, and research officer at the UCT Research Unit on the Economics of Excisable Products, Dr. Zunda Chisha. All right, up next.